కరోనా మరణాలను ప్రభుత్వాలు తక్కువ చేసి చూపిస్తున్నాయని, రెండో దశలోని అధికారిక లెక్కల కంటే కనీసం 15 లక్షల మంది ఎక్కువగా చనిపోయి ఉంటారని అహ్మదాబాద్ ఇండియన్ ఇన్స్టిట్యూట్ ఆఫ్ మేనేజ్మెంట్ I.I.M అర్థశాస్త్ర ఆచార్యుడు చిన్మయ్ తుంబే అంచనా వేశారు. ఇది ప్రాథమిక అంచనా మాత్రమేనని, ఈ సంఖ్య ఇంకా పెరిగే ప్రమాదం ఉందన్నారు. ఆంధ్రప్రదేశ్, మధ్యప్రదేశ్, కర్ణాటక, తమిళనాడులోనే అదనపు మరణాల సంఖ్య 5 లక్షలకు పైగా ఉన్నట్లు చెప్పారు. ప్రస్తుతం దేశాన్ని హడలెత్తిస్తున్న కోవిడ్ వల్ల సంభవించిన మరణాలతో పాటు ఇంతకు ముందు మహమ్మారుల వల్ల కలిగిన ప్రాణనష్టంపై ఆచార్య చిన్మయ్ తుంబే పరిశోధన చేస్తున్నారు. ఇటీవల ది ఏజ్ ఆఫ్ పాండమిక్ అనే పుస్తకాన్ని కూడా రాసిన ఆయన 2016లో వలసలపై కేంద్ర ప్రభుత్వం ఏర్పాటు చేసిన బృందంలోనూ సభ్యుడిగా పనిచేశారు. అహ్మదాబాద్ I.I.M అర్థశాస్త్ర ఆచార్యుడు చిన్మయ్ తుంబేతో ఈనాడు అసోసియేట్ ఎడిటర్ విశ్వప్రసాద్ ముఖాముఖి ఇప్పుడు చూద్దాం.
మనకు సంబంధించిన వారు ఎవరైనా చనిపోతే వారిని మనం గుర్తుంచుకున్నంత కాలం వారు నిజంగా మరణించినట్లు కాదని బ్రిటిష్ నవల రచయిత మేరీ అవాన్స్ చెప్పారు. మరణించిన వారిని మనం ఎంతగా గౌరవించాలో ఆ మాటలను బట్టి మనకు అర్థమవుతోంది. కానీ ప్రస్తుతం మన కళ్ళ ముందు జరుగుతున్నది ఏమిటి? కోవిడ్ వల్ల చోటు చేసుకున్న మరణాలకు ప్రభుత్వ లెక్కలకు దారుణమైన తేడా ఉంటుంది. దేశంలో కొన్ని లక్షల మంది కోవిడ్ మృతుల పేర్లు అధికారిక లెక్కల్లోకి ఎక్కడం లేదని నిత్యం వార్తలు వస్తున్నాయి. దీంతో వారి కుటుంబాలకు ప్రభుత్వ సహాయం ఎండమావే కానుంది. ఈ నేపథ్యంలో అసలు భారత్లో కోవిడ్ వల్ల ఇప్పటివరకు వాస్తవంగా ఎంతమంది చనిపోయి ఉంటారు, ఎంతమంది లెక్కల్లోకి రాకుండా పోయారు అనే అంశాలపై పనిచేస్తున్న అహ్మదాబాద్లోని ఇండియన్ ఇన్స్టిట్యూట్ ఆఫ్ మేనేజ్మెంట్ అర్థశాస్త్ర ప్రొఫెసర్ చిన్మయ్ తుంబే ఈరోజు ఈటీవీ భారత్తో తన పరిశోధనపై మాట్లాడేందుకు సిద్ధంగా ఉన్నారు. Now it is becoming increasingly evident that the data relating to the COVID-19 deaths released daily by the governments is not accurate. From your research, what would be your estimate of the total death toll because of COVID-19, including the both waves in India till today?
Since we still don't have all the information, it would be very premature to give an overall number. But let me just say that first, the underreporting factors are much higher in the second wave than in the first wave. So in the first wave, the reported COVID deaths were about 150,000 odd. Right now, the underreporting factors people are saying it might be 2, it might be 3, but it's not very, very high. So that's the part about mostly 2020, which happened. So in some states, we are finding now that a lot of excess deaths did happen, which were not reported as COVID. What we do know, however, is that in April and May this year, the second wave of COVID was very, very rapid and very, very dangerous. And it took a lot of lives. All of us have been affected in some way or the other. What our research is now showing is that for just 4 states of India, which is Andhra Pradesh, Madhya Pradesh, Karnataka and Tamil Nadu, for which data on all-cause deaths is available, over 500,000 people died in excess of usual times. 530,000 excess deaths for these 4 states alone. And there are just 46,000 reports. So we are talking of an underreporting factor, a potential underreporting factor of over 10 for 4 large states of India, which comprise about 20% of the population. So I would place the minimum, the lower bound of excess deaths in just 2021 to be at least 1.5 million. Now that is a lower bound, a very conservative estimate. The upper bound, because we don't know full information for Uttar Pradesh, for Bihar, for Rajasthan, for Jharkhand, so many states of India, the number might go very, very high as well. All states of India collect death registration system. It's called CRS, Civil Registration System, which means if somebody dies, we go and get a death certificate. Because remember, if you die of COVID, but you did not test positive, many people don't have testing facilities. Then you are never classified as COVID dead. So even without deliberate misreporting, you can get a lot of underreporting simply because in rural areas, testing facilities are not there. Now with UP and Bihar, there's an additional problem. That is, even in normal times, not all deaths are registered. Unlike in South India, where a lot of deaths are registered, we are saying more than close to 100% death registration system. In UP and Bihar, it's very poor. So how will we know how many people died there? We'll have to wait for the next census.
India and several other countries in the world had faced the influenza pandemic in 1918. What were the issues in estimating the actual death toll of 1918 pandemic?
Yeah, but just like now, the influenza death toll was initially placed very low. The health commissioner of that time, Norman White, in February 1919, influenza came in 2 waves, just like COVID in India so far. Influenza devastated in the second wave. We are saying September, October, November 1918 were terrible months to live in. And the first estimates were given by Norman White, who said 6 million people are likely to have died. Note If we had used our current protocols to estimate deaths back then, we would come at a number called 0, simply also, left this mark of high fever. So he said, okay, if we classify how many people died of fever, roughly in this time period, September, October, November, he said 6 million people must have died. Then that number got corrected by this next census, which happened in 1921. And the census officials realized that so many villages simply don't have people. Why? Because a lot of the people died in the influenza pandemic. So they kind of used an estimation method and they got the number over 10 million. Now, over time, many researchers have used more and more scientific estimation methods, and they have taken that number up and up. And my research shows, for example, that about maybe 20 million people must have died in the influenza pandemic. So that's 3 times the original figure, 6 million.
When compared to the 1918 days, a number of new technologies and modern communication systems are available now, in spite of which we are not able to collect accurate data about the deaths. Where does the real problem lie?
The problem is that we are not releasing this data. The government is holding on to this data because the government feels that if it gives this data, people will start judging it, saying that, oh, how the government has governed badly. But in a pandemic, what you should be doing is good dissemination of data. So I don't think the problem is in collection of statistics. I think the problem is in releasing those statistics. Because remember, for the first wave now, after 1 year, we are realizing that in Andhra Pradesh, for instance, there were many excess deaths in August and September last year, which was simply not picked up in the official COVID reporting. So what we need to do is to basically release on a daily basis, just like daily we tell how many COVID cases and how many reported COVID deaths happened. We need to release the data which is available with the civil registration system and say how many total deaths were registered at every district on every day. Of course, these numbers will be revised because there's some clerical kind of work involved, and we can say maybe the last 2 or 3 weeks can be marked as provisional data. But this data is very important because that will tell you exactly where the deaths are going up and where more attention and more resources have to be diverted.
Not only in India, even in developed countries like the USA, there are differences between the official numbers and actual numbers of the COVID deaths. Why is this happening?
That's a good question. The underreporting factors in many of the rich countries is placed between 1.5 and 2, which means for every 1 reported COVID death, the actual number of COVID deaths could be 1.5 or 2. So that is the range of underreporting factors you're seeing in the US and many other rich countries. Even in India, in 2020, people are finding for Mumbai, for instance, which has released its data, the underreporting factor in the first wave, that is in 2020 broadly, was in the range of 1.6 to 2. Right? And if you see many other cities of India, it was low. What has happened is that the second wave has been much more devastating. And as a result of which, many things have happened. One is the difference between the first wave and the second wave at the all India level is that the second wave has gone more into rural India. Now, rural India does not have that much testing facilities, which means you're likely to die without ever having tested. So obviously, your underreporting factors will go up that much more. Secondly, the hospital system was completely overwhelmed across India during the second wave, which means, a lot of people simply could not get the testing done in time, even if they had the access, because remember, there was constraint on testing capacity. Third, not all excess deaths need to be necessarily COVID-19 deaths. You could have a heart attack, but you could have been saved if the hospital bed was available. But now, unfortunately, you couldn't make it in time because the hospital was. So there is also collateral damage, which has happened in the second wave, where a lot of people, because of the focus on COVID, a lot of other diseases are also activated. So not the full number of excess deaths is COVID-19, but we should be concerned with all excess deaths, because it's like asking in a war how many civilians died and how many soldiers died. There is always collateral damage. And so in a pandemic, we have to see all excess deaths in a pandemic. And that is why we should be concerned with this number of excess deaths.
What are the consequences of the undercounting of the COVID deaths?
There are huge consequences. Let me give you a simple example. In April and May, when we had to allocate oxygen or medicines, the central government, the union government was doing these allocations on what basis? They were doing it on the reported COVID cases and the reported COVID deaths. Now, here's the funny thing. On the basis of reported COVID deaths, Karnataka, on a per capita basis, has done much worse than Madhya Pradesh. But on the excess deaths parameter, Madhya Pradesh actually has suffered much more than Karnataka. So our entire allocation system was completely distorted because the ground reality from the reported deaths number was showing a completely different picture. Scarce resources should have been going to places which were really, it is still not too late. Each and every state government, because it's a state government issue, should release these statistics. so that in the future, if there is a wave, we will know exactly which districts are being hit and then send resources out.
There are similarities between the times of two pandemics. The river Ganga was swollen with dead bodies in 1918, and it has happened in 2021 too. What is the reason for these kind of failures after the 7 decades of independence?
Yes, it was very, when I was writing my book on pandemics last year, and I wrote about the bodies floating in Ganga in 1918, I did not expect that the same would happen in 2021. And this can only happen when the number of deaths exceeds so much that, cremation grounds are overfull, people are just dumping bodies. And of course, we've heard these terrible stories of 1918. I think, one big policy failure at multiple levels is the failure to anticipate how deadly a second wave could be. I think, we took it very lightly after, say, December last year. And if you just seen the chart of 1918 influenza pandemic in India, if you had just seen the chart of what was happening in the US last year or Britain last year, you will see that pandemics come in waves, right? And so unfortunately, our system was completely overwhelmed in the last 2 months. And that is why we got these horrific visuals of, across India, crematoriums full. And unfortunately, the Ganga also, lot of bodies were there. Of course, the situation is not as bad as in 1918. We are saying in 1918, 20 million people died. The number now is much smaller than that. But of course, we should be, not comparing with 1918 in the sense of death count. We should be doing much better than 1918. And unfortunately, in the last 2 months, across India, we seem to have failed quite spectacularly.
What are your suggestions to the governments to minimize the human loss when pandemics occur?
Yeah, all pandemics require very, very hard decisions. And obviously, even if the government ticks all the boxes in the right measures, unfortunately, some people will die in a pandemic. So, it is a very tough job the government has to do. Having said that, the one thing the government should do is be paying very close attention to the latest science, right? Which means basically ensuring, so what is the science telling us now? Basic protocols which have to be followed in terms of wearing masks and so on. Now we know about vaccines, so we failed to order the vaccines in time. Now we have to ensure that the population, the maximum coverage of vaccination as quickly as possible. We should anticipate waves rather than saying, that we are, I think I heard some of the ministers say, the COVID is over in February and March, or we are in the end game of the pandemic. These are not things that you say in a pandemic. Pandemics come in waves. And as I've written in my book, the 2 key traits that are required is patience and humility. Pandemics do take time. You need to be patient and you need to have the humility that, you just can't defeat a pandemic. You have to bear it out. You can do that only if you have good statistics, if you can release those statistics on a timely basis. And at least one concrete suggestion to the government would be to make the death registration statistics of all causes, not just COVID, available on a daily basis at the district level for all the 700 plus districts of India. That in itself will tell us on a real-time basis how the pandemic is doing and how we should be allocating our resources.
You have worked as a member of the Government of India's working team on migration in 2016. You did a lot of research on that issue. You wrote a very good book on that issue also. What are the implications of the COVID-19 on the lives of the migrant workers? What are the steps to be taken by the government to address these issues?
I think the government has taken some steps in this issue. For example, the One Nation, One Ration card. But unfortunately, a lot of migrant workers don't know about the scheme. We need to do much better job in communication that migrant workers can now access ration, for example, which was historically never there. Migrant workers in India never had portability of social security. You could access social security only in the place you're born in or the village where you were raised in and not in the destination region. The basic problem with migrant workers in India is that migrant workers don't have a political voice in the destination region. So vaccination of migrant workers should be of topmost priority, and construction companies, employers must take on the responsibility of vaccinating this huge number of migrant workers.